Hey guys, our functional range conditioning class today is going to be focusing on hip internal rotation. We're going to need a chair, a kitchen chair, and also some yoga blocks or something that we can prop your hip up with. So let's get into our class. Okay, let's warm up with hip cars. If you don't understand how to do this, please go into previous videos of how to do our hip cars. We can do this in different positions. Today we're going to do this in a standing position. Again, breathe in, irradiate. Really important that we do that. We create full body tension. And then what we want to do is go into hip flexion. Come up as far as we can. Now we abduct. We kind of create the biggest circle possible. Then we come into internal rotation and we extend back as far as we can in extension and back into that neutral position. We don't want to be compensating through our spine. We just want to be working that focus joint, our hip joint. Then we come back, we extend, find our roadblock, then we external rotate. We fight for external rotation, going back down into that neutral position. Let's do this from the side. So breathe in and irradiate. Come into flexion, we go abduction. Now we start to internally rotate, fight for internal rotation, keep fighting for that internal rotation as we extend back, slow and controlled in the pain-free range. Neutral position, now we're coming back into extension, find our roadblock, then we go into external rotation, fight for external rotation, biggest circle possible, and come back down into that neutral position. Okay, let's do 4 reps on each side. So breathe in and irradiate. We're searching for the best possible movement, the movement that we have ownership over, an active motor control over. Slow and controlled, pain-free range. This gives us a baseline of our hip mobility and where we're at and what we need to work on. It also helps gives the nervous system information, gives nutrients to the joint, helps us maintain our range of motion, and helps us to have that active control in our outer range, opening up more mobility health. And last one. So going into our last one, internally rotate, fight for internal rotation. And then we come up into extension, coming around. Fantastic. Okay, let's do the other side. 4 reps, breathe in and irradiate, coming up into hip flexion, abduction, internal rotate. Good. Extend, externally rotate, coming up. Try not to compensate with other parts of the body. Slow and controlled. Great, amazing. Okay, we want to get into our internal rotation base. We're going to use a chair for this. We're going to sit on the edge of our chair and we're going to go into anterior pelvic tilt, sitting up straight. So this is posterior pelvic tilt. This is anterior pelvic tilt. Anterior pelvic tilt is going to help you to get a deeper stretch in internal rotation. So we want to get into that bear or sit bear position. We want to prop our feet up. I'm using yoga blocks for this. You can use books if you don't have yoga blocks. Bringing our feet up, and we're abducting, and we're also externally rotating into our sit bear position. Now, to get into internal rotation base, we're going to bring our knee across into this position, finding our stretch and line of tension, sitting up straight, and we're trying to find a stretch in this position. So it's really important that we try and align our knee with our pelvis. So we don't want you too far in this alignment. See how the knee and the hip don't align? We want you to just change the position so this hip and knee align. And we also want the knee and the ankle to align there as well. And sitting up straight, anterior, find the line of tension. Okay, there's my stretch. I can feel it deep into that hip joint there. This is where we want to hold our 2-minute stretch. So let's turn on our timer. So this is our 2-minute stretch. Just breathe in, find that line of tension, and get into that stretch. Want to make sure that we don't have too much pressure on the knee there. You may have to move things around if that's the case. If you're just starting this exercise, certainly just low intensity with the stretch and for the PAILs and RAILs contractions as well. Let's go through our PAILs and RAILs cues. So we're going to do a PAILs contraction. That's going to be pushing up into my hand. So we're going to be doing this movement, okay? We're pushing up into my hand. We're going to be doing that for 15 seconds. Safe and best effort contraction, okay? We want to build up to best effort, okay? Now, our RAILs contraction is going to be the opposite movement. We're going to be pushing or making my hand lighter off my knee. We're going to be going down further into internal rotation. So the movement will be that way, okay? Excellent, let's get into our position. Just holding that stretch. I'll count you in for our PAILs contraction. We've got another 30 seconds to go. So by doing our PAILs and RAILs contraction, we're strengthening in our outer range. We're in our passive range, so that allows us, our nervous system, to lay down more receptors so that we can have active control and spatial awareness. And we're strengthening the outer range, so that allows us to be able to have that more mobility health. Okay, we've got 10 seconds to go. So 5, 4, 3, 2, 1. We're pushing up into my hands, which is going into best effort and safe contraction. So if it feels safe, just pushing up, keep going, keep going. 3, 2, 1, opposite contraction. I'm trying to make my knee lighter off my hands. We're going this way into internal rotation. Keep going, keep going. This one can be quite crampy because our nervous system hasn't been into this position. 3, 2, 1. And we haven't had active control in that position. So it's your nervous system's not used to that. Your muscles aren't used to that contraction or having active control there. So if it's a bit crampy, just back off that contraction. Okay, we're back into our stretch again. We're just finding that line of tension, making sure we're sitting up straight, anterior pelvic tilt, and just finding that internal rotation stretch. Okay, so another 5 seconds. 3, 2, 1. We're pushing up into my hand. PAILs contraction here, building that up to best effort. Great. 3, 2, 1. Opposite contraction. We're trying to go deeper into the stretch, into internal rotation. You can use your hand down below to create that resistance. I like doing that. 5, 4, 3, 2, 1. And relax, going deep into that stretch again. So what we do is a 2-minute stretch, 2-minute stretch, PAILs and RAILs contraction, 45-second stretch again, PAILs and RAILs contractions, and then a 45-second stretch after that. So our contractions are going to be 15 seconds. So we're going to do it on the other side. We've got another 5 seconds here. 3, 2, 1, slowly come out of this base. Okay, we've got to do our lift off. So what we want to do here is we're going to internally rotate and then coming up into our hand. Internally rotate, coming up into our hand. So we're going to do 12 reps. 3, 4, 5, 6, 7, 8, 9, 10, 11, and one more 12, and we're holding it for 10 seconds. Keep going, keep going. 5, 4, 3, 2, 1, and just slowly come out of that base. Fantastic. Now we've got to go to the other side. So again, we just need to get ourselves into that sit bear position. And then we need to position our other hip, our left hip, to internal rotation. We want to line things up a little bit. So I've got to change my position just a little bit. Into anterior pelvic tilt. We're going into that. Okay. So that would be my stretch. So let's then start our timer for our 2 minutes. Okay, just bringing it into the stretch. Make sure that we're aligned for the hip and the knee, that our ankle and knee are aligned. We're in that 2-minute stretch. Sitting up straight, just find the line of tension here. Making sure there's not too much pressure on the knee. And feel that stretch. Great, I'm going to count you in again for our PAILs and RAILs contractions. And this is just 2 minutes. I can tell for me, I'm getting more of a stretch and internal rotation on this side compared to the other side. You might notice that too, that you might have one hip a little bit better than the other. Great, 25 seconds to go, and I'm going to count you in for our PAILs contraction. That's going to be pushing up into my hands. It'll be a 15-second contraction, best effort. 5 seconds. 3, 2, 1, slowly pushing up into external rotation. Pushing your knee into my hands, building up that contraction. 3, 2, 1, opposite contraction. I'm gonna use my hand at the bottom here so I can use that to push my knee down and in into internal rotation. 5, 4, 3, 2, 1. Now find our stretch again. Try and go deeper into it. You may have to change things just a little bit to keep everything aligned. "45-second stretch." Okay, 15 seconds and I'll count you in. Okay, 5 seconds and we're doing a PAILs contraction, pushing up into my hands. 3, 2, 1, push. Best effort here. 3, 2, 1, opposite contraction. We're going deep into the stretch and internal rotation. Best effort here. 5 seconds to go. 3, 2, 1, and stay in that stretch. Try and go a little bit deeper into it if you can. Sitting up straight, anterior pelvic tilt, just find that line of tension. This is a 45-second stretch and recovery. Great, 5 seconds to go. 3, 2, 1, slowly come out. Now we need to do our lift-offs. Just gonna move this over just a little bit. So we're gonna go down into internal rotation and back up. So 12 reps, 1, 2, 3, 4, 5, 6, 7, 8. This is so that we can give our nervous system some experience in that range that we've just opened up. 11 and 12. We're going to hold it for 10 seconds. 12, hold, keep holding, keep holding. 5, 4, 3, 2, 1, and just slowly come out of that base. And a little bit of recovery. Fantastic. All right, hip cars. Let's get into on all fours. We breathe in and irradiate. We come into hip flexion. We then go into abduction and internal rotation, searching for the best possible range, searching out for the movement that we have ownership over for just our hip joint. We don't want to be moving other areas of our spine to get this movement. So we don't want to be compensating. We just want to be moving this hip joint. So slow and controlled, searching for that space, creating the biggest circle possible. Good, going to hip flexion. We then internally rotate, abduct, search for that space, fight for internal rotation and extension, then going back into that neutral position. We then extend back, find that roadblock, then we externally rotate, fight for external rotation. What space do you have ownership over? That's what we're asking. Great, we want to do 4 reps on this side and 4 reps on the other side. Great, last rep, going into flexion, abduction, internal rotate. Fight for internal rotation as you're coming up. Try not to compensate through the back, go into extension, back into our neutral position. Into extension, find our roadblock. Now externally rotate that hip. Fight for external rotation, coming up into flexion and into our neutral position. Okay, so let's do our other side. 4 reps on this side as well. Great. Breathing in and irradiating, coming up into flexion, abduction, internally rotate. Really search for that best possible space without compensating other areas of our body, especially our spine with this one. Great, just really slow and controlled. It's not how fast you do it. We just want to search for that space, get into that outer range. What movement do we have ownership over? Our CARS allows us to know it's the base or the foundational exercise for our hip. This is a representation of what the joint can do and gives us ideas of what we need to be working on and also our mobility health as well. Great, that's 4. Well done. Okay, capsular CARS, we want to lay on our back for this one. Bringing our leg up into that 90 degrees, our hip, and then we internally rotate and externally rotate. So just slow and controlled. Now we've opened up that space with the PAILs and RAILs contractions and stretch. We now just want to internally and externally rotate. Give our joint capsule and nervous systems that information about that space that we've just opened up. Okay, last rep. Really try and squeeze out as much internal and external rotation as we can. We go to the other side. Again, internally and external rotation. Okay, last rep, squeezing out that internal and external rotation. Great. So we want to see how we pull up after our PAILs and RAILs contractions and when we're in those bases. If you're pulling up a little bit sore, we know we just want to decrease the intensity with the depth of the stretch and the intensity of the contraction. But if you're feeling great, then we know that we can go that extra level of intensity, and we want to go best effort, but safe contraction and safe intensity. So we just want to build this up over time. We want to get re-education, adaptation of those tissues. We want to get active control and better mobility. So let's give it a go.